Hi, I'm Dr. Sasha Stoltz with First Choice Sports Rehab Center. Here at our clinic, not only do we address both chronic and acute injuries to athletes, but we also want our patients to be able to train efficiently and effectively. Two of the tools we use to help our athletes train are resting metabolic rate testing and VO2 max testing. You may have also heard VO2 max testing referred to as lactic threshold. Let's start with resting metabolic rate, or RMR. RMR is a passive test measuring the oxygen to carbon dioxide exchange rate while the patient is at rest wearing a mask. This test identifies the number of calories a person needs to consume in 24 hours if they were to sit around and do nothing all day. The RMR can be done as a standalone test, as it also gives an estimate of what your caloric burn would be with 30 minutes of moderate aerobic exercise. This test is a great option for those starting their journey to weight loss and who do not currently have a fitness routine, or for those who exercise at low to moderate intensity a few times per week. VO2 max testing, on the other hand, is an active test where the patient is running or cycling for up to 15 minutes, gradually building to a maximum effort, while hooked up to a mask that also measures oxygen and carbon dioxide exchange rate. Essentially, this test will help the athlete and their coach identify the athlete's starting fitness level, as well as their ideal heart rate training zones. With this information, the coach can properly design an annual training program and avoid pitfalls of overtraining, which often lead to fatigue and injury. We often retest mid-season so training can be adjusted to accommodate any fitness gains. As an endurance athlete myself, as well as a triathlon and a swim coach, I highly recommend testing both the RMR and VO2 for athletes training for an event, for individuals looking to fine-tune their caloric consumption, or those seeking to quantify their fitness level. Our research-grade VO2 testing gives a more accurate caloric burn rate at different intensities of exercise. By combining the information from the two tests, a more targeted approach to nutritional planning can be achieved. We want to make sure the athlete is consuming enough calories throughout the day, including the appropriate amount post-workout, so they avoid fatigue and unintended weight loss, which can also lead to injuries. On the flip side of that, we may even need to curb their caloric intake to avoid weight gain. This is often a problem with athletes beginning a new sport or those returning to sport after an injury, when their increased appetites can exceed their caloric burn, a time when they can't quite justify that extra slice of pizza.